Okay. Hi, everyone. Thanks for joining us for this session today. I'd like to just let you know to write your questions in the chats, and we'll address them at the end of the session. We have several speakers with us today. My name is Fatuma Abdullahi. I'm a communications advisor with MSF for Sudan, South Sudan, and Central African Republic. Médecins Sans Frontières, MSF, will be referring to the organization as MSF throughout the webinar, is a medical organization that works with over 70 countries to provide life-saving assistance where it's needed the most. I'm going to quickly introduce our speakers. I'll start with Malat, who has over 15 years of experience in the humanitarian field. She has worked in different countries, designing, implementing, monitoring medical programs. She's currently leading medical programs in Sudan, South Sudan, Eswatini, and Mozambique. And then we'd have Rafael, who has over 10 years experience in the humanitarian field, working in tropical medicine, logistics, and coordination. He's currently the head of emergency coordination for Sudan with MSF. And then we have Claire, who has 10 years of experience with MSF. She's worked in HR, finance, and operations, and is currently the head of emergencies for Sudan and East Chad. So welcome to our session. So I'll start with you, Malat. Talk to us about the medical situation in Sudan, even before the crisis, to give our listeners a bit of context.
All right, thank you for having me, Fatima. So MSF has a long story in Sudan. MSF has been providing medical assistance for the past decades. Before the escalating of violence in April, health system has been extremely fragile in Sudan, with health indicator being consistently low. Access to healthcare has been a major challenge for the majority of Sudanese people due to under-resourced health system that results due to their economic situation. Millions of under 5 children and pregnant women in Sudan has been having limited access to healthcare. There have been recurrent outbreak, malaria, malnutrition, cholera, but also violence in the past. MSF has been working for the past decades in 12 states of in 12 states in the country, responding to different needs in primary, secondary health care, ranging different activities in the hospital, clinic, and mobile clinics as well. The activity and the service we have been providing was reproductive health, nutrition program, mental health, but also respond to different emergencies due to recurrent violence, but also outbreak, as I mentioned above, malaria, malnutrition, cholera, but also needs due to displacement and conflict that includes mental health support. So last year alone, in 2022, MSF has provided outpatient care for 500,000 people and inpatient or hospitalization for 21,000 people. MSF still maintains its presence in Sudan and repurposing the medical activity to the current needs. So with this, I will leave the space to my colleague Rafael to give us a glance of what's happening in the country. Thank you so much.
Thank you very much, Malat. So basically, that's the overview of the medical activities that MSF is doing or has been also doing in Sudan. I'll continue to Claire. I'll continue to Claire. Claire, could you tell us about what we are currently doing, not just in Sudan, but also in the bordering countries where the conflict has overflown into basically places like Chad, for example.
Yes, hello, everybody. Very happy to be a part of this webinar with you guys. Indeed, as you mentioned, we are not only working in Sudan, even though we have activities in Khartoum, we have activities in Darfur. So we are really continuing since the beginning of this war to provide as much as possible with all the difficulties you can imagine, the health care we are giving. Nevertheless, as mentioned, we have also really a lot of refugees in all the countries around Sudan. One of them is Chad. In Chad, we are speaking about more than 120,000 refugees since 2 months. Really dire living situation in makeshift camps. So they are really along the border, most of them. And with the rainy seasons, some of them had to be moved. And there is an ongoing relocation in existing camp or newly built camp made by UNHCR. So we will have, we are now responding to this Sudanese refugees crisis in Chad by opening new activities in one new camp called Akum. So this is an ongoing situation, and we are continuing also actively in other different refugee camps as support. So for these refugees in Chad, the MSF response is medical care, vaccination, support to hospital and health centers, and water and sanitation as well. Then in terms of wounded, so since 1 week, we received a very big number of wounded coming from Jenina, which is in West Darfur, up to Adre, where we have a project where we are supporting the hospital. So when I say a very huge number of wounded, we received 1,000 wounded in 5 days. 1,000 wounded in 5 days, and most of them they have gunshots. So most of them they were, I mean, not most of them. Some of them they were wounded in Jenina. Some of them they were wounded on the road to go out of Jenina to go to Adre. So they were shot down on the street and on the road going out. So this situation, you can imagine 1,000 patients is very massive. And of course, we are continuing as well following other patients, so maternity patients, pediatric patients as well. In the 15,000 new refugees we received from Jenina to Adre, for instance, most of them they are children and women. So there are lots of malnutrition. There is malaria coming. So they are really pediatrics is also super busy with all these activities.
Okay, thank you very much, Claire. I'll quickly refer back to Raphael. Raphael, could you please tell us about and what we're doing currently in Khartoum and Wad Madani?
Yeah, can you hear me? I apologize. I had some issues with the internet. So yeah, I might start quickly to give a bit of an overview of what we do in Khartoum at the moment. So we launched surgical activities, trauma, focusing on trauma at the Bashar Teaching Hospital in Khartoum about 6 weeks ago. We are now in the 6th week of the surgical activity. And this was a hospital was not functioning before our team arrived there, and we basically sent a full surgical team there about 2 weeks after the conflict in Khartoum erupted. And so yeah, the needs at the very beginning were quite overwhelming, and were basically since the start of the activity dealing with a mass casualty situation basically on a daily basis. Last 6 weeks, five weeks plus 3 days, we received more than 1,400 trauma cases in the emergency room there. So that is only trauma cases. There is no medical cases. There's no sort of outbreak of patients suffering from infectious disease or non-communicable disease. It's only trauma patients. It's quite an overwhelming number. And then over the last 5 weeks, we also did 400 plus surgical procedures at the OTs at the Bashar Teaching Hospital with the surgical team there. So just to put it a bit in proportion, there's about 3 times the surgical procedures we did in the first 5 weeks of the Mosul emergency response in 2017. So it's quite overwhelming. We are now the current surgical team will be reinforced on Friday. Is existing of 2 surgeons, one anesthetist. Will add another surgical team on Friday. They're on their way to Khartoum right now to deal with this massive influx and amount of mostly weapon wounds. It's gunshot wounds, bomb blasts, and other trauma cases very much related to the violence and the conflict in Khartoum. We also see a fairly huge amount of about 10% of the trauma patients are stabbing wounds, which also it's concerning because as an indicator, these stabbing wounds are related to either gang violence or economically motivated crime. So that also gives us quite a good idea of the disintegration of the social fabric of the society there, and the fact that there is a full breakdown of law and order. It's quite concerning. Challenges we face are mainly security related. We had since the early beginning of the emergency response in Khartoum quite a high level of cooperation from the authorities and from the armed actors on the ground when it came to deconfliction and allowing the team and the supplies to move into that urban conflict zone in Khartoum. But yeah, with some of the violence being, or some of the fighting being in direct proximity of the hospital, that is of course led to some situations where there was shelling and there was airstrikes fairly close to the hospital. Last Saturday morning, for example, there was an airstrike in about 1 kilometer proximity to the hospital, and the hospital team and patients were not impacted, but 2 of our national colleagues there lost a total of 16 family members in that airstrike, with 25 houses being destroyed, again a kilometer away from the hospital set. So it's challenging. It's not a modus operandi which is very commonly chosen by us to have the surgical activities directly on the front line. Another dilemma we face, another challenge the team faces, is that it's almost impossible, or it is impossible to refer then patients we cannot treat at the Bashar Teaching Hospital outside of Khartoum, and that would be, for example, neurosurgical cases, which we of course not equipped to deal with that at the hospital. But the ICRC tried to evacuate some weapon wounded earlier this week, and that convoy got shot at by snipers, and it was not possible even for the ICRC to evacuate patients out of Khartoum. So that's also challenging. I mean, on the positive side, supplies, staffing, and keep the facility running without electricity and getting spares full for the generator to keep the lights on. That's in itself a challenge, but of course we managed so far for the last 6 weeks. But then the security situation remains utmost concerning. On a daily basis, we had a ceasefire for 3 days earlier on this week, but as soon as this ceasefire ended, yesterday morning at 6:30, the shelling and the airstrikes continued on a scale which we are not normally used to with such a intense activity, but also with such a big expert team. And then so yeah, that's a bit
sorry
impression
to
on
cut you
Khartoum.
off.
And then sorry, you're muted. I can't hear you.
Yeah, we're running a bit on time. Sorry about that. I wanted you to also a little bit touch on the crisis, crossing borders, and if you could explain the critical situation where MSF is responding to in Andre, Chad, where people are fleeing from West Darfur. If you could touch a little bit on that, as Claire had just explained to us how we've been responding to the influx of people running away or fleeing from the conflict into Chad.
Yeah, we are as with MSF Belgium, OCB, we are not operational in Chad. We really focused on Khartoum, and then on the internal displacement in Wad Madani, because we also see a lot of people. And now the last 3-day ceasefire was this chance was used by a lot of people to flee Khartoum, specifically now poorer people who hadn't had the means to flee before, and most of these people do move to Wad Madani. Which is fairly safe, and there hasn't been any fighting there so far, and that's where our other operational focus is, because a lot of these IDPs do get stranded there without access to healthcare, without access to safe drinking water, and of course with the malaria season and specifically the poor wash situation in these IDP sites and now also outside Wad Madani. It's quite a big challenge for us, where we were also since 5 weeks really responding with quite huge numbers in those mobile clinics, 3,000 patients in a matter of 3-4 weeks, but also because of the environmental hazards, the fact that there's no that Wad Madani is not able to deal with this large influx of IDPs, specifically in an urban setting. The provision of safe drinking water and other wash activities is also quite vital there, which is operationally also quite heavy, given the constraints around this emergency responses.
Just to add a bit on that, I think MSF has been working in Al Janina, West Darfur for the past years. I think the response was due to ongoing outbreak of measles, but also malnutrition and severe pediatric patients. But then I think with the conflict, access has been very limited for MSF to do anything in that hospital. The hospital was looted and medical staff has fled, and the people were like closed in Al Janina. I mean, the one who managed to cross the border are the one who are managed in Adere. But we are hearing a weakness of sexual violence. We are hearing a weakness of different kind of violence. But as Claire mentioned, malnutrition, people who have been wounded, but pregnant women who are needing a basic care, to deliver or, to feed their new infants. So I think it has been challenging for the past 2 months how to access the people in Al Janina, because literally there is no access and we cannot do anything even if we are ready to do something.
Thank you very much for that, Melat. I'll switch to Claire. Claire, could you tell us the situation, that we are currently seeing in Sudan as it spills over to, Sudan, Chad, and it's been over 2 months, as Melat just mentioned, since the intense fighting broke out in Sudan's capital in Khartoum and across the country. So according to the International Organization for Migration, IOM, there are more than 1.9 million people who have fled their homes so far, and with a further 531,000 people fleeing to neighboring countries. Could you please paint a picture of the humanitarian situation today?
Yes, so yeah, the situation obviously we spoke about internal displacement, so lots of people have moved out. Rafael just touched base on Wad Madani, which is one of the example. We touch also upon the different camps refugee camps in Chad. For instance, in Chad, there were already 400,000 Sudanese refugees. Now you add 120,000 refugees on top of that. So it means that lots of new camps are opening, but also the resources are not enough also to cover for all this in terms of water, in terms of even displacing people up to these camps, in terms of health, in terms of hygiene, etc. Sheltering, obviously. So the situation for all the countries around, it means like it's also a bit way for them to be able to respond to this dire situation and humanitarian situation. Fortunately, we see more and more actors among, of course, MSF, that they are starting responding to this influx of refugees.
I think if I could add a bit more on that about globally the health situation and what to come. I think this is the season that the people plant their crop, and then I think the violence disrupting that. It's also the rainy season where you see a lot of outbreak diseases, and we know that almost 70% of the health facilities in Sudan not functioning, shortage of the supply and safe access for medical staff to be able to do their job. So I think the situation is getting worse and worse, and then access has been difficult for anyone. So I think we should be prepared for the worst, and to call for access to be able to respond whatever needs that would be coming in the coming weeks and months globally in Sudan.
I mean, generally speaking, what are the most concerning aspects of this humanitarian crisis that you think we should talk about and address?
I think there are many people are disrupted from the NCD treatment. According to OCHA, 50,000 children, malnourished children, are disrupted from their treatment. No access for healthcare except for emergency life-saving, no supply almost, and then I think we are running today, or some states are running minimum activity. So I mean, as I mentioned already, the health system is in the verge of collapse now. All this violence and lack of access to healthcare, bringing the health system to a breaking point. And I think the need is immense. It's food, it's water, it's health. So there is a big need, and I think there is a humanitarian need, I would say so.
Sorry. So we've seen that MSF has reported many challenges, such as looting of medical supplies, insecurity, which has hindered their movement, within Sudan. Talk us through some of the challenges the medical teams are experiencing when delivering life-saving assistance in Sudan. Any of the speakers can pick on this.
Okay. Yeah, so I can go. Yes, so as exactly you mentioned, we are facing so many challenges, and I think that we comment on some of them. And difficulty of movement is one massive one. So in terms of insecurity, of course, but not just in terms of insecurity, because sometimes even we don't manage to get the permit to move easily from one place to another, to move supply, etc. So there are lots of difficulties like this also to deliver to the proper place. Of course, it has been mentioned a lot about the access itself, because we mentioned Janina, which is a very good example, but there are also other areas you cannot go at all. So we know that there we are even almost blind in terms of what are the needs there and our capacity to respond, which is a major problem, obviously, for us, because we should be able to touch almost all the population who needs healthcare, and this is not the reality. Unfortunately, yes, we have been facing lots of looting, meaning that in our warehouse, in our offices, in hospitals. So we mentioned also Janina for this one. In Darfur, particularly, lots of hospitals have been looted. Not only just MSF ones, but for instance, in Khartoum, it's very few hospitals that are still functioning today. So this is a massive problem because population cannot move easily, for instance, inside Khartoum, so they cannot go to the hospital. So this is, yeah, there are lots of difficulties. Rafael was mentioning about bombing, all these that we are airstrikes, etc. that we are facing, that is putting our teams in danger, and for us not being able to manage as we would like to move everywhere, for instance in Khartoum, but not only, because in Darfur as well, very clearly.
So thank you guys for sending in your questions. We are receiving them. As soon as we are done with our speakers, then I will ask them the questions that you've sent in. Let me move on to the next one. So is MSF still committed to staying in Sudan, and responding to the situation in the surrounding countries, despite the challenges that, Claire has just described?
I think MSF has maintained its presence in Sudan, with all the challenges. I think what Rafael mentioned is a very good example in Khartoum, and I mean around Khartoum also we maintain, the service for Ethiopian refugee in Marakuba. And then I think from the 11 states that we had been providing healthcare in the past, currently 11 are maintained and then providing a minimum service due to the shortage of supply, and I think medical staff who doesn't have safe access as well.
Rafael, would you like to add anything to that? Rafael, can you hear us?
Not in particular. No, I'll think. Yes, I can. Can you hear me?
Yes, now we can hear you. So, okay, let me then move on to the next question. What would you say are the three most urgent asks for people, caught up in these conflicts? What are we seeing? Rafael, can you hear me? Okay, can any of the other speakers hear me? I think he's having internet issues again. So the last question is basically, what would you say are the three most urgent asks for people caught up in this conflict? Claire or Melat, please take it away.
I think the first thing I would say is, safe access to MSF or, to anyone who would like to provide, assistance for the people who are caught in this conflict. I think during this kind of conflict, it's the innocent, it's the civilians, it's health workers who are suffering. So, whoever have a power to grant this access, I think we are requesting for that access to be able to our medical job and, to provide assistance for people who need it even most now more than ever.
Okay, I'll move on to the questions from the participants now. Our first question is, are patients safely accessing your facilities in Khartoum, or do you have a feeling that majority injured do not reach your facility?
Yeah, sorry, can you repeat this one? Sorry, I was cut.
So it's okay. The question was, are patients safely accessing your facilities in Khartoum, or do you have a feeling that majority injured do not reach your facilities, basically MSF facilities or other hospitals, I guess?
Yes, that's definitely one of the major problems. Definitely. So for us, we have, as MSF, we have 2 main hospitals in the south of Khartoum, supporting others by donation as well, HR reinforcement, etc. But this is definitely one of the main problems. There is no possibility of ambulance reference and so on. So this is not existing anymore. So really people are trying to manage as they can to go to the hospitals, but as mentioned previously, most of the hospitals are not functioning. So yes, this is definitely one of the difficult parts, and that's of course people also when they are trying to get to the healthcare facility, sometimes they are stopped on the road, so maybe they will go not as quick as necessary, and also of course there is the problem of being caught in crossfire or in this any insecurity situation.
Are there any facilities currently, like MSF facilities or like MSF supported facilities through either donation or whichever way that are functioning and, you know, are receiving patients somewhat despite the challenges?
Yes, of course, and as mentioned as well before, we are really scaling up. So that's a good part. We are really managing little by little to scale up our response in Khartoum, with all the challenges we mentioned, but and also visa challenges, by the way, because we are not managing to make under as many people we would like to respond to the needs today. So this is a difficulty, but fortunately, yes, we managed to respond to not only surgical needs but also maternity needs and all kind of healthcare needs. So this is still promising in a way.
Okay, we have another question from a participant. He says, or he or she says, hello, I'm Barde from Nigeria. MSF is operating in both Juba and Khartoum or only Khartoum?
Both in Juba and Khartoum. South Sudan is a very big also mission for MSF. So yes, both sides we are working in both sides, and we spoke about also refugees in Chad, for instance, but we are also responding to refugees influx in South Sudan indeed.
I think most importantly in South Sudan, there are nearly 100,000 South Sudanese returnees from Sudan, where MSF is trying to support how to integrate them in Sudan, but I think mainly we are addressing the medical in there as well.
We have one last question that says, can you discuss the security challenges and risks that MSF faces while operating in Sudan and how the organization manages them to continue providing essential medical assistance?
Melat, you can go if you want, because I spoke.
Let's see if Rafael is able to hear that, and if not, yes.
Rafael, yeah, if he's able to reconnect.
Yes. Can you hear me?
Yeah.
Yeah, we hear you, Rafael.
Ah, yeah. So, sorry, what was the question? Come again, because I.
You mute, Fatuma.
Sorry about that. Technological hiccup. So the question was, can you discuss the security challenges and risks that MSF face while operating in Sudan and how the organization manages them to continue providing essential medical assistance?
Yeah, I mean, one of the main security measures, or the main security measures, which we of course apply in in Sudan and in Khartoum, and we can actually testify to that security measure working, is building acceptance by the medical services and the activities we provide. And this is mainly amongst the warring parties to the conflict. And we do have very concrete examples where we have the acceptance we need currently still to continue to provide these life-saving activities in Khartoum. On the side of the government of Sudan, there's a clear there was clear signals from the highest level in the Sudan armed forces and the government that our presence in south of Khartoum is accepted, and receives the support and the consent from the government and its authorities. This is not only, we of course went through formal deconfliction mechanisms with the Sudan armed forces and the government of Sudan, clearly highlighting our presence repeatedly in the south of Khartoum in order to avoid being targeted in airstrikes or in artillery shelling, and that deconfliction is successful. We received the green light from the government and the authorities to work there, and not only in written and not only via lip service, but we can also see that we get on a weekly basis the clearance from the government and the authorities to bring supplies and international staff from Madani, from outside into Khartoum. So that is the one main security risk mitigation measure. But then also from the other side to the conflict in Khartoum, the rapid support forces, there's a lot of efforts from them to also deconflict with us, and the key asks to keep the hospital, the Bashar Teaching Hospital, a weapon-free zone is complied with, which is very positive and very exceptional in such a situation, in such an urban warfare situation of that high intensity. But also the green light for our movement in and out of Khartoum is not only given by the Sudan forces, but also by the rapid support forces. And so, yeah, that again, our analysis is very clear that this is based on the acceptance we built and the recognition we have as a neutral, impartial actor in this conflict zone. And then, of course, I mean, when it comes to more technical security or risk mitigation measures like structural things, having a safe zone within the hospital with a maximum of protection against things like shelling and airstrikes, and having bomb blast film on the windows in the hospital. Of course, these more technical measures also applied for. But again, I would really highlight that one main thing which keeps our team safe is the acceptance we were able to build based on the medical activities we provide and the recognition of being a neutral, impartial humanitarian actor in that urban war zone. Don't know if that answers the question.
Thanks, Rafael. So another question is, can you discuss the collaboration and coordination efforts between MSF and other humanitarian actors in addressing the healthcare needs of conflict-affected populations? I'd like to just let know our viewers is that some of the questions have been answered. So I'll skip over the ones that have been answered and ask the ones that haven't been answered yet.
Yeah, I can answer this one if you want. So there is collaboration definitely with other actors. Fortunately for us, we received some donation as well from other actors that they couldn't, for instance, operate. So they were kindly giving us some support, surgical kits, etc., which is really good. But we have to say that there are not so many actors today, especially in Khartoum and in Darfur. So MSF is not alone for sure, but to be completely honest, and I will let my colleagues add if they don't think I'm accurate in this one, but we don't see so many actors in the most dangerous areas, meaning for instance Khartoum or Darfur. Of course, in other places, yet there are lots of actors. and especially for IDPs, for instance, and there we are really working on collaboration and on good collaboration to try to not overstep one another. So this is a bit the situation. And for sure, yes, we do discuss with the directors to respond in the best way.
So another question is, hello, for a long time, it was not possible to obtain visas to bring in additional staff. It seems that a few visas have been obtained. Do you feel there's been an opening in this area to get more staff basically into Sudan?
So for me, I would say that it's not like an opening. It's like sometimes we receive a couple, sometimes we receive a few visas, and then sometimes it stopped for a little while, and then we have some again. So I would say it's it's on and off. But yes, globally, that's the good news that we managed to have quite a number, and we did request a lot because we have lots of needs to be covered, and if we could, we really multiply, I think, by 2 or 3 our teams, at least international staff. So that's definitely one of the issues we are having, even though, yes, we did manage to get some, and we did manage to reinforce our work.
I think if I could add a few points on that, yeah, I think in the past few days we managed to get 3 to 5 visas. However, you know, the question remains, you know, how can you have access to be able to reach people today? You know, it's the reality in Al Janina, West Darfur. We don't have access for either international staff or national staff to be able to provide any service. So I think that is what we are looking for, and we are asking.
Okay, can you discuss the impact of the conflict on mental health and well-being of the affected population and the measures taken by MSF to address these issues?
Obviously, I think this is a big issue, but I think, you know, the big impacts to be seen, you know, when we have open doors to be able to implement, you know, many activities. For the moment, we are dealing with the acute need for the various reasons that we have given before. You know, we are providing care for the surgical cases, we are providing care for the acute and emergency needs, and then of course emergency mental health needs will be addressed. But I think, you know, the impact of the war on the people, it's obvious, but it's to be seen and to be addressed as soon as we have access to manage that. My colleagues could add, I think, if I am, you know, underestimating whatever I say on this.
So that's it for the questions that we've received from our viewers today. So as we wrap up, I would like each of the speakers to just, you know, tell us something that you feel it's important for us to talk about or put out there, be it about the civilians or our services that we're offering and the hardships that we're facing in terms of working in Sudan.
I think first of all, I will say really thank you very much for the Sudanese staff who are making it, you know, possible with this extremely difficult circumstance. I think they have been giving a lot, either medical staff or volunteers. So I think they are brave to be able to do that. Of course, I will add our international staff who are contributing to that, but also, you know, I would like to add, you know, when do we have, you know, safe access to some of the areas that we don't know exactly, you know, what's happening, but we know that already before the conflict, there are big needs, and you know, this is the season, you know, to have outbreak, to have, you know, malnutrition. So, you know, give us safe access, therefore we provide health service. This is our only interest, you know, to reach the people and then to be able to provide health care and humanitarian needs. Thank you very much for having us. It's my last word.
Claire?
Yeah, if I can add on this one, I think it's quite important. What we are managing to achieve with very few staff on the ground and with very limited resources. We didn't speak about cash, but we have massive cash problem as well. We have fuel problem, we have oxygen problem. Well, we have lots of issues basically. But what we are managing to achieve with small teams and with the engagement of these teams is pretty well, it's pretty wonderful, honestly. So yes, it's a very important point mentioned here.
Rafael?
Yeah, look, I mean, again, probably the main highlight in this humanitarian crisis is the exceptional levels of violence and the exceptional levels of insecurity our teams are exposed to, both in Khartoum and in Darfur, and but then obviously also the impact on the civil population, and it's almost beyond comparison when we're dealing with a lot of these conflict situations worldwide, but the one in Sudan right now, even compared to the levels of violence in Ukraine and to the impact on the civil population in Ukraine, it's almost, the situation in Sudan is almost beyond comparison, and also with the restrictions we face and with the challenges we face, we are, I think, Claire, you might confirm that we're almost on a daily in permanent crisis mode, on a daily point where we have to ask ourselves the questions: is this still sustainable? Can we not, let alone the need to upscale whatever we do in the entire country, but specifically with the situation in Khartoum, there's a daily question: can we still is it still responsible what we do to expose our teams to this level of violence, and for how long is this sustainable with the restrictions around this emergency response? And this is absolutely exceptional. And to that end, I mean, the only solution to the humanitarian crisis in Sudan is obviously a political one, and to bring that violence to an end. And I mean, these small little windows of ceasefires, we saw so far, in particular two, the first functioning 24-hour ceasefire and then the latest 72-hour ceasefire, were not only a relief for our teams, but also very much for the population who was able to restock on food and water, but then also eventually able to leave the conflict zone. But yeah, I mean, the only solution to the humanitarian crisis in so many, but particularly in Sudan, was the levels of restrictions around the response, and also the slowness of the response and inadequate scale of the humanitarian response because of the restrictions around it, is only a political solution and an end to that unprecedented level of violence, which we both see in Khartoum and Darfur.
Thank you very much, Rafael, Claire, and Melat, for taking your time today. And thank you, everyone, for participating. The situation in Sudan, as you've heard, is really dire. And so let's keep all the people of Sudan in our hearts and minds. To keep up to date with what is going on and what we're doing, follow us on all our social media channels and our website to find out more. Thank you very much for joining us today.
Thank you to you, Fatima, for having us.
Thank you.
Thanks a lot.